Everyone, and welcome. We are so excited to bring you into a brand new webinar today from Renuance Cosmetic Surgery and Medspa. And this is a very unique webinar today because we have not one, but three MDs here to speak to you all and give you their best recommendations for how to tighten your skin and make your body and face look like you want it to after weight loss. So let me go ahead and just make sure to introduce you to the practice and the doctors before I hand it off to them. So Renuance Cosmetic Surgery and Med Spa, we are a full service plastic surgery center and med spa. We have two locations, one in Murrieta, Temecula area, and one in Rancho Bernardo, so the San Diego area. And we offer a full service of plastic surgery and med spa procedures. Today, we are talking specifically about the skin tightening treatments, but of course, we offer all sorts of plastic surgery and all sorts of med spa treatments. I also want to introduce you to our amazing speakers. So first up will be Dr. Debbie, and she is a board certified physician and the founder and medical director of our medical spa. So she heads up all of the non-surgical treatments at the office, from injectables to lasers, and of course, all of the skin tightening and skincare. Then we will go on to Dr. Hill, who is a board certified plastic surgeon, and he's going to speak specifically today about options for the face and neck when you lose weight and have sagging skin. Now, just want to make sure you note Dr. Hill does also do surgeries throughout the whole body, but today he's focused on the face and neck. And then last but certainly not least is Dr. Rachel Ford, and she will be bringing us home by talking about all of the surgical options for the body after weight loss. And then at the end, we will open up for a live Q&A. So if you have any questions, please put them in the little chat box below or the Q&A feature on Zoom, and we will get to as many as we can. This is live. It is Wednesday, April 9th here. So we are here to answer your questions, and we hope to support as many of you as possible. We definitely understand that it's amazing to lose weight off many of the injectables that are out right now, but we want to make sure that you guys all know what your options are after you lose the weight to get your skin tightened back up and how you want it to be. And most importantly, I want to tell everyone that's here is that you are not alone. This conversation is one that we're having all day, every day right now. Everyone across the whole country is dealing with this. And the good news is we can help. And I think at Renuance, one of the reasons why so many people are coming to us for this condition is because we offer both the surgical and non-surgical approach. And we can definitely help guide you to which one is the best fit for you. And so you're not going to be pushed into our, only one solution. So with that in mind, we are ready for Dr. Debbie to start sharing her screen.
Okay, great. Thank you, Risa, for that lovely introduction. So, what I'm going to talk about are the non-surgical strategies we have. I'm going to go over a couple of the common facial concerns with weight loss, why these occur, and then our non-surgical strategies in the med spa. So the common aesthetic concerns that people usually see in their face when they've lost weight is hollowing in the cheeks, the eyes look a little sunken, you get loose skin, the skin does tend to look dull, and some jowling. And the extent to which this occurs is all individual. So it can be dependent on age, genetics, the amount of weight loss, and also the time it took to lose the weight. This is just a photo so you can see there's multiple layers in the face. We have the skin, the fat cells, then we have muscles, and then obviously we have the bone as well. The weight loss mainly affects the skin and then also the fat layer. So in the fat layer, what happens is those fat cells shrink. They don't completely disappear, but they shrink. And so when that occurs, you get volume loss, and the volume loss results in changes in the contour of the face. In the skin, which also has multiple layers, we've already talked about the fat layer, we've got an epidermis and a dermis. The epidermis is the outer layer. It has barrier function. It helps keep in water. What happens during weight loss is typically the cells aren't turning over as much, so you don't have a nice thick layer. And then also what can happen is we're losing more moisture because the cells aren't functioning as well as they normally do. In the dermis, which carries our collagen and elastin, the collagen provides tightness to our skin, and the elastin provides that stretchability so it bounces back. During weight loss, the cells aren't producing as much collagen, and the collagen is being broken down. So then what you have is skin that kind of gets saggy. Sometimes we say crepey, and then you lose the contour as well. Okay, so what are our strategies? Well, nutrition and hydration are very important for skin health. So that needs to be taken into account. We'll ask you what you're doing with regard to that, but we want to reemphasize that it's very important. Skincare regimens are very important as well. So we're going to go over what your skincare routine is. There's been a lot of improvement in skincare over the last many years. There's a couple things that we're going to recommend right off the bat. Absolutely sunscreen. I think everybody understands we're trying to prevent more UV damage, so we want to put that on there. Retinol and retin-A's are very important because they promote collagen production. And then also in these situations with weight loss, vitamin C is a great protector of of collagen so that it doesn't break down as quickly, but it also stimulates collagen growth. And then, of course, we're going to have our in office treatments, which are going to include energy devices, the injectables, and another category I'm going to put them in is biostimulators. So let's talk about the energy devices that we have that can help with some of the changes. The CO2 laser is one of our strongest lasers. Its purpose is for resurfacing. It's going to stimulate the dermis and the epidermis to increase the cell turnover, promote collagen production. It's going to take away those light lines and then also some of the deeper wrinkles. It's going to take care of pigmentation and also that dullness that we talked about that's going to occur. Now, it is a powerful laser, so there is going to be a recovery time. Um, so if recovery time is an issue for you, then we do have lighter lasers that can address many of the same issues, maybe not to the same extent that CO2 does, but we have an Advalite laser. It's a non-ablative laser. What it's going to do, instead of wiping out that upper surface, it's going to stimulate the cells in the dermis underneath. And that's why when you leave, you really don't have much more than a little bit of redness. But it will help with the fine lines, stimulate the collagen, and also improve pores. You'll need more sessions with the Advalite laser, which is fine. Radio frequency is another tool that we use. Radio frequency uses electromagnetic waves, which create heat in the skin, and that heat is a really powerful stimulator of collagen. So this is a good tightening procedure. We have a couple of different machines, Thermi Smooth, very comfortable, no downtime, meaning no recovery time, but you're going to again require multiple sessions, anywhere between 4 and 6. And then our more powerful one is Morpheus 8, which is a nice combination of the radio frequency with microneedling. A great machine that also does a little bit of resurfacing. So what we're going to be doing is providing some skin tightening. We're going to be improving texture, tone, and collagen production and elastin production. So the other things that we like to combine with these treatments are number one, our neuromodulators, Botox, Dysport, Xeomin. We're still going to recommend that you continue those treatments to relax the muscles. That's going to help make those fine lines and those deeper lines around our eyes and forehead dissipate. Dermal fillers is an option in the med spa for replacing volume. We use hyaluronic acid fillers mostly, but we also have Radiesse, which is a calcium oxalate based filler. So it also has the ability to stimulate collagen without, too much volume. And then we have treatments like microneedling, safe in all skin types. This is a great treatment. Lots of research going into that to produce collagen, improve that skin texture. It's really improved when we add PRP to it, which is what we get from you. We draw your blood and we spin it down and we get all those great factors that help collagen production. And then we also have lighter treatments if you're not ready for these deeper ones. We have a lovely esthetician who can do facials with you. We perform light peels on the med spa side. And then also an underrated one of Skin Vive. These are some photos here. This lady had a CO2 laser. This is her before the laser, and this is about 6 months after. You can see the improvement in the fine lines and pigmentation. She just has an overall brightened look. This is her I wanted to show because she's been a patient for a while when she came to us for a couple years. Really, the only things that she has done is really consistent skincare, the Botox 3 times a year, and then the CO2 laser. And there's quite a bit of improvement in her overall skin texture and tone. This lovely lady, she was having just a little bit of weight loss, intentional, like about 5 pounds. She came in, so we did Morpheus to help tighten her skin. If you could pull on her skin in these pictures, it would be great. You would see how much tighter it is, but you can also see the brightening and how much healthier the skin looks. And then I did want to add a photo of the hyaluronic acid fillers. This lovely lady also weight loss, and you can see where she's looking a little gaunt. And so what we did is we added hyaluronic acid filler. It looks very natural. It doesn't make her face look heavy, and she's very happy with it. All right, so we have many non-surgical options to address weight loss. We kind of went through a whirlwind here, but the non-surgical treatments can actually start at any time during your weight loss, and actually it can help prepare you for surgery if that's what you need. We're going to encourage you to come in a little sooner than later, but it's up to you what you would like to do. We do thorough consultations so we can understand your goals and develop a customized plan for you. If during that consultation, we realize that your goals are for more skin tightening, or the requirement is for more skin tightening, then we're going to refer you to our board certified plastic surgeons, who we collaborate with quite often. And now that's who I'm going to hand this off to. So thank you for your attention.
Board. We're ready for you.
Hey, can you see my screen?
We can. We're ready to roll.
Okay, so I'm just going to touch on multiple areas of the body, but I did want to start with who's a good candidate for surgery. So I do want your weight stable for at least 3 to 6 months before surgery to let the skin retract as much as it's going to. I want your BMI less than 35, but ideally less than 30 to minimize complications and to get the best aesthetic results. I do want you to have realistic expectations about what we're trying to achieve. There's going to be scars with all of these surgeries, but it is a trade off because that's how we get a better contour for all of these body regions. I do encourage a high protein diet, around 80 to 100 milligrams per day, at least a month before and after surgery. So, a lot of times when people are on these GLP-1 medications, they suppress their appetite so much so they're not getting enough protein. So I really want to prepare your body for surgery and to optimize your healing. No nicotine at all. No patches, no vapes, no gums, anything. Don't even look at it, don't smell it, nothing for at least 6 weeks before and after surgery, to minimize complications. I need you to stop the GLP-1 medications at least 3 weeks before and after surgery as well. And then you really need to maintain your weight long term to maintain the results of these surgeries. So, starting with the breast, a breast lift, we remove extra skin and sometimes breast tissue to lift the nipple to a better position on the breast mound. A lot of times, implants are used as well if you want more volume on the top part of the breast, what we call upper pole fullness. So, this patient did have implants with her breast lift. A lot of times, for my massive weight loss patients, their tissue quality is not great. So, I use a mesh for added implant support. So, these mesh materials for breast, they're not a permanent material, but they're long lasting. So your body replaces this material over about 2 years with scar tissue, but that scar tissue is stronger than your native scar tissue. So it just gives more support. It's placed at the bottom part of the breast, kind of like a sling. So it just helps add, again, more kind of support for an implant. And then most of the time, we're using this anchor incision pattern for this surgery. And then moving on to the abdomen, an abdominoplasty is often known as a tummy tuck. And this is going to help improve the contour of the abdomen in different ways. So it helps remove the extra skin by literally cutting it off. If there's still extra fat, Then liposuction is always included with this surgery. And then a lot of times the abdominal muscles have separated, or what's called a diastasis, with pregnancy or with weight gain. And so those are tightened up as well. So these all work together to get a smoother contour of the abdomen. And if I'm working on the abdomen and the breast, that's where that term mommy makeover comes from, kind of working on the whole region. So this is just an example of a patient who had a tummy tuck. I really try to get very natural results, and I spend a lot of time on the belly button. I feel like that's something that draws your eye a lot to the results afterwards. These are just some other quick patients. One of these patients had a gastric bypass, lost 100 pounds. She did not need liposuction. You can just see it's a lot of extra skin. And I tell patients there's no exercise for the skin. So once it retracts as much as it's going to, that's where we come in to excise it. There's no other way to get rid of it. If patients go into someone who takes insurance, they may be covered for what's called a paniculectomy, where just a roll of skin can be removed without the actual undermining of a tummy tuck. This patient went to just a chain place that is known for liposuction, and they do some minimal surgical procedures. So this patient had a paniculectomy and then liposuction, but what they really needed was an actual tummy tuck. So this is the same patient that was unhappy with her results. And then I did an actual tummy tuck. And so you just need to be careful. You need to go to someone who can do all of these surgeries. And so they help decide the surgery you actually need and not just what they can do. So they need to kind of explore all your options and explain your options and why it's correct for your body type. Because this is another option. A more aggressive abdominoplasty is called a fleur-de-lis. If you've lost a lot of weight, a standard tummy tuck with the incision from hip to hip only pulls extra skin down. And that's adequate for most patients. But if you have a lot of extra tissue, you actually need to pull in as well. So this patient has the incision from hip to hip. And then, as you can see, an incision running down the midline as well. Now, she's only 7 months out, so her scars are still red. And this is kind of when they look the worst. She's going to look great once these have faded. You could tell if you can just pull this tissue down, she's going to look better, but she's going to look great once these incisions have faded. And this waist is so much more narrow by pulling this tissue in as well. So again, it's still a trade-off with more incisions, but I've removed so much extra tissue by pulling the tissue down and removing this roll and then pulling it in as well. She has a much narrower waist, looks so much better in clothes. Obviously, she had a breast lift as well. And that was her primary goal. And obviously, I explain all these incisions during a consultation, and we talk about that beforehand. And she said, I'm not worried about the scars. I just want to look a lot better in my clothes. And that's, what we achieved. I did want to mention that we use both Dr. Hill and I love our Vaser device. We use it almost every time we do liposuction. We use it right before the liposuction. It uses ultrasound to gently break down the fat cells first. So it basically kind of melts the fat before we do the liposuction. So I can remove more fat. It is gentler on your tissues. There's less bleeding and bruising, and it helps a little bit more with the skin contraction as well. Basically, there's better results. It goes through the exact same incisions as the traditional liposuction, and there's no additional recovery. I think it's just a great, not everybody has this device. We use it almost every day in our operating rooms, and we love it. And then again, these are just some of my mommy makeover patients. Both of these patients had a lift with implants and a tummy tuck. Moving on to the arms, an arm lift. When we get to the arms and thighs, Obviously, these incisions are not well hidden compared to a tummy tuck. So again, it's a big discussion with patients. But if you have this much skin on the arms and thighs, there's no way just doing liposuction is going to make a significant difference. You have to surgically excise this skin. In most patients, the scar goes from the elbow to the armpit. And if there's a considerable amount of excess skin, then it goes that incision and then along the lateral chest wall as well. And it can even join the incisions for the breast lift. So we're usually doing liposuction first and in that same surgery, and then excising as much skin as we can. I like to have this incision on the inside of the arm, so then when the arms are down, you can't actually see it from standing behind. But this patient is a year and a half after her surgery. So these scars look great, but it takes a long time to get there. And there's always going to be a scar. She actually lost, I think, 30 pounds after her surgery. So she still does have some skin laxity, but overall, she looks great. She's super happy. But there's just no way to get these results without cutting the skin out. And then moving to the thighs, this patient had bariatric surgery. So for most patients for a thigh lift, you can see in this diagram here, the incision goes up in the groin here and then extends down to about knee level. For her, I did liposuction of the outer thighs and then more the inner thighs down to the knees, and then removed a lot of the medial thigh tissue because again, you want to have the incision on the inside of the thighs. She's only 6 months out in these photos, but you can already see the dramatic reduction in the contour and size of her thighs. I did a tummy tuck on her as well. She's feeling great and super happy with the results. And of course, the incisions will look better and better with time, but there is that trade-off there. But she is looking great and is super happy. And then moving on to the butt. So everybody's heard of the Ozempic butt. When you lose a lot of weight, you lose it everywhere in the body, including your butt. So this is different than a BBL. A BBL is when you do liposuction from multiple areas of the body to remove fat, and then you inject that fat in the butt to increase the volume of the butt. A buttock lift is when you remove extra skin to lift the butt. So you can see here, she has an incision above the butt that's about the same level of a tummy tuck incision. She just wanted to remove a lot of the wrinkles, just wanted it lifted, didn't want her butt bigger. She's only 5 weeks out from surgery and then she moved away. So I didn't have further out pictures. Obviously her scar is going to look better and lighter with time. I did a thigh lift on her as well, but you can just see the dramatic difference with removing the skin, how it's just lifted, more youthful looking. She just wanted to wear a bathing suit this summer and not have a saggy butt. When people have lost a lot of weight, a lot of times they need a few different surgeries, and that's totally an individual plan. So when patients come for a consult, we kind of get a plan together based on their priority areas, what bothers them the most. And then usually I can operate on about 2 different areas during a surgery. A lot of times Dr. Hill and I operate together and assist each other. And then I recommend waiting at least 3 months in between surgeries to let you heal and recover. And then I did show a picture here of what's called like a body lift. If you're doing research and come across that term where you have an incision all the way around, I don't do this surgery in one stage because we are an outpatient surgery center where you go home that same day. Generally, I will do the abdomen first, maybe with the breast or the arms. I just don't like to do the front and the back at the same time. I think it's too much for recovery if you're going straight home. So anyways, we kind of just get an individualized plan and then wait 3 months in between surgeries. It's a little hard to talk about recovery because we talked about so many different surgeries. But in general, patients are usually off pain meds within 1 to 2 weeks. I do inject a long-acting pain medication during surgery around the muscle repair for tummy tucks, which helps a lot the first couple of days. I do usually have 1 or 2 drains during a tummy tuck. And then if I'm doing liposuction, I like compression garments for about 6 weeks. And then basically no restrictions after about 6 or 8 weeks, depending on the surgery. Most people are back at work around 2 to 3 weeks, depending on the type of surgery and then the type of work that they do. Perfect.
Impressive to see by Dr. Ford, and I am excited for you to see some of Dr. Hill's so that we can all chat about this together. Does anyone have any questions already that we could start with? Oh, here is one. So Dr. Ford, can a lower body lift be done with an arm lift?
It's hard. It would be a hard recovery because then you're basically walking around like a mummy, and you need a lot of help. So it would just be a very hard recovery. Yeah, so I wouldn't recommend it.
Okay, so you would probably do it in a staged approach then, not all at once.
Yeah.
Okay. So Brittany, yes, we can do it. We would just probably stage it out, but we would talk through, the pros and cons of doing it together or not. Yeah, if you want to be a mummy in bed.
Yeah. Believe me, when you're you probably regret it the first time you need to use a restroom.
Well, that's the honesty we appreciate. Thank you so much, Dr. Ford. Okay, Dr. Hill, it looks perfect. We are ready for you.
Just to show you this diagram here, with aging and weight loss and everything, you start getting wrinkling in the face, you start getting saggy skin, your brow starts to droop, you get puffiness in the lower eyelids, you deepening the nasolabial folds, and deepening of what we call marionette lines and jowling. And as we move forward, what happens is you'll just see progression of aging in this diagram as you're younger, and then it gets a little bit more advanced as you go on. And this happens with aging in general and sun damage as well as weight loss. But there's some people that come in that maybe have lost a lot of weight, but they don't necessarily have an issue with a lot of loose skin, or maybe they're a younger person and their skin quality is a little better, but they've got a little looseness. So some of the things we can do that are not really true surgical, we can use Renuvion. A Renuvion is a radio frequency process that we use with this wand, which has a sterile end on it. And it works along with helium. You don't have to have anesthesia. You can certainly have this done in our procedure room with local. It's very comfortable once you get numbed up. This is Dr. Ford, who allowed me to share her photographs. And as you can see, she doesn't have a lot of laxity of skin. It's kind of hard to see from the actual front view. But if you look on the side view, you can see we were able to get some skin tightening from this area to this area post-op. And you can see from the two sides. Now,
I love it.
If you need more tissue removed in the form of an actual surgical procedure like a neck lift or a facelift, the gold standard would be what we call a deep plane face and neck lift. And you can see the shadowed area. Someone that would undergo the face and neck would have an incision where your scar would be in this dotted line here. We would undermine the skin in this lighter region. And then in the deeper structures of the neck and the face, we would go into the deeper structures of the face to help move it as a composite unit. So this helps to pull everything back to the upward direction in a vertical direction and give you a skin tightening that is a much more youthful look. So I've actually gone through bariatric surgery and also have been on the GLP-1 medications. This was me in 2015 when I was 315 pounds. And then 6 years after that surgery, I was down to 190 pounds, but my face looks sallow. You've got all of the wrinkling and you can see all the loose skin in the neck, but I'd also lost 125 pounds. And so I decided I needed to do something about this. And I had a few connections so I could get it done. And you can see in the neck, you can see what we refer to as the platysmal bands and the loose skin, and we've got jowling along here. And so I went through and I had this done. This is after having a face and neck lift, and I had 70 cc's of fat placed in my face to fill it out from all of the hollowness. And a lot of times with facial rejuvenation, adding fat is really important. So this is me prior to having the facelift, and this is me 3 months post-op. And this is me currently. Now, I'm also a type 2 diabetic, and because I'd had the bariatric surgery, I had what they call a gastric sleeve, which doesn't totally cure diabetes, but with the weight loss and having all of this done, it certainly made my diabetes a lot better controlled. I was originally on something called Victoza, and then I went to Ozempic for 4 years. And last year, my physician switched me over to Manjaro, which allowed it to give sort of a jump start. And now I'm at 180 pounds. And my goal weight all along from the original surgery was 170 pounds, but you don't always make that. So these are just some examples of patients that have come to me who've either had weight loss or due to aging have wanted to have something done to tighten the skin. This is a particular patient, and you can see this is where, just like the diagram I showed you earlier, this is the area we go under the skin, and then further down towards the lip area, we go deeper into the deeper structures. That's her on the day of surgery. This is her pre-op and 3 months post-op. And this is a side view of 3 months and post-op. She had a very obtuse angle to her neck. You can never get somebody a chiseled jawline with this type of anatomy. You can certainly get some improvement, but she still looks natural looking. This is a young lady that we did a deep plane face and neck lift. We did what we call a quad lift, where we operated and repaired her eyelids. We also did temporal lift to elevate the eyebrows, and she had fat placed in her cheeks as well as in her lips. This patient had very much the same thing as well, and I think you can see she's got the refreshed look, but she doesn't look like a different person. She just looks well rested and a younger self. This patient had sort of the gamut of everything. She had the brow lift, she had her eyelids done, she had a facelift, she had a neck lift, she had CO2 laser, actually all at the same time. We don't usually do that all at the same time, but in this particular patient, she was a good candidate for that. And this patient is someone who enjoys the outside, does lots of gardening, has had lots of sun damage over the years, and she wanted to do something because she's very active, and she wanted to look the way she felt. So we did the same surgery on her, and this is a picture of what she looked like pre-op and then post-op after having any makeup on. And then we brought her into the office, and we had a makeup artist to work with her. And you can see the combination of things that can be done to give you that more youthful look. But there's lots of options we had surgically, and everybody's different. We don't always do all of these procedures on anybody. They may just have a face done with the neck. Occasionally, they'll just have the neck done, or occasionally they'll just have their eyes done. But most all of them will usually have some form of fat grafting added to the face to fill the volume that's lost over time. So these are the things that we can do to help improve the appearance of the face and neck. So if there's anything that you guys are interested in, please feel free to contact us. We'd be glad to discuss these things with you. And I think we can now open this up to questions.
All right, on schedule. Thank you so much, doctors. That was amazing. And yes, guys, this is the time to ask your questions. So I see a bunch of them coming in right now. Please add as many as you would like. There's very few opportunities to get all three of these MDs at your attention. All right, here's the first one. So this one says, I'm concerned with the belly button after a tummy tuck. Why do some look good after surgery, but most don't?
It has a lot to do with technique and some also the anatomy, but as someone who's known as a belly button queen, it's something I do spend a lot of time on, and it can be because it's such a telltale sign. It's just something you have to pay attention to during the surgery. I do a certain technique that I feel like hides the scar well. It's a little bit more difficult to do, but Dr. Hill does it very similarly. Not everybody takes the amount of time that we do. So I think it's good if you're looking into this surgery to try to look at as many before and afters as you can. So there's just so many different ways to do it that it's, yeah, but just know that we spend a lot of time on it during the surgery because we know how important it is.
All right. I love that. And Dr. Hill, do you have anything to add to that?
No, but she is the belly button queen. I will say that. So
I have actually watched.
even when we do combo cases together on her patients, she's definitely the one that's going to do the belly button, and she does a great job.
Yeah. All right. So here's a good one. Dr. Debbie, I've heard most lasers are not for brown or darker skin. Is that correct? Do you have options for me?
Yes, so we do have, and you're correct. It's most lasers and that type of thing can burn skin. So we do have some devices that we can use in darker skin. So usually, what we do is you have you come in for a consultation, and then we take a look. And then determine which one would be best for you. If we don't have one that's best for you, I certainly have a center that I can refer you to if it's dark. Yes. So absolutely. You always have to be concerned about that.
Yeah. All right. Here's a good question. Can you do a facelift and a tummy tuck together?
The short answer is yes, it can be done together, and it really depends on the patient. Most of the time, I prefer to stage it, but there have been times when it's been done together. But this is the other reason our entire office of surgeons, we really work together. And if there's someone that maybe they don't need a lot of work done, they need some work done. And I know that sounds kind of vague. It's possible to do them together. But for the most part, generally, if they're having a pretty complicated facelift or they have pretty complicated body work, we usually stage them. And just like Dr. Ford said, most of the time, if patients are looking for multiple things to be done, and the few things that can be done together are great, but most of the time, we like you to wait at least 3 to 6 months between procedures so you have plenty of time to recover from the first surgery.
Right. For body surgical procedures, Dr. Ford, do you often use a Bridget clips for incision healing? I've had tension issues in the past with a breast augmentation and stretching of the scars.
It depends. So I have used Bridget, and then I've also used silks, which are both newer techniques to help reduce tension. So it does depend on where the incisions are. Because, for example, on a breast augmentation, if you have the incision down in the crease of the breast, you can't use the Bridgets. They can't be placed there. But you can use the silks, which are just a topical dressing to help reduce the tension. But you're exactly right. We want to help reduce tension because that leads to better scarring. So we just have multiple ways that we can help do that.
Here's another good question. I am scared to have surgery, but I have bags under my eyes. Are there any non-surgical options for me, Dr. Debbie?
Well, certainly, if the bags are too much, then we might not. I mean, the ideal situation would be a surgical procedure. So usually, what we do is look at it. We can improve, the skin tone and texture around it. But we're not going to be able to replace surgery. And we would be able to tell you that during a consultation. If you're a surgical candidate, we can improve it, but we're never going to replace surgery in those situations. But there are options.
Mm-hmm. So since we offer complimentary consultations in our med spa, I would suggest, making an appointment, and I'll pop a link in right now so you can do that, because it really is something we should see in person so that Dr. Debbie can advise and tell you honestly if it can be done non-surgically. And then if not, you certainly could get a consultation with our surgeons. All right. Oh, this is a great one, Dr. Ford. How soon after weight loss do you recommend surgery?
3 to 6 months after you're around your kind of ideal weight or your goal weight. Because again, we want to give the skin time to retract as much as it's going to. because we want things to be pretty stable. So we know exactly what we're working with. I know exactly what procedure you're going to need, because I don't want your weight to fluctuate a lot after surgery. Because if we do surgery and then you lose a whole bunch more weight, then you're going to have extra skin. Or then if you gain a lot of weight after surgery. So I want you to be kind of around where you're going to be. And I want you to have a BMI, ideally less than 30 if possible, to minimize risk of complications. So, it needs to be time. I don't want you to lose weight in an unhealthy way. I want you to lose it so your body is like ready and ready to undergo surgery. I don't want you to be malnourished. Like, that's not the time to jump into a big surgery. Your body has to be ready to heal. So we just want to do that in a slow and safe manner so you're ready to recover.
Got it. That is very helpful. And I think that, that's always so important to make sure that you get the best results, to think about that. All right. Here's another question. I am 47, but I have some concerns with my neck. Could I be a good candidate for surgery? I am overall in good health.
The answer to that is yes, you could be. Without seeing you, it's hard to say, but there's a lot of people that their neck bothers them a lot. And if somebody comes in, I tell them, I'm going to talk to you about what you're interested in, but you're there and I'm going to evaluate your entire face and neck area. Sometimes all somebody might need seriously is something simple like Renuvion, or a little bit of liposuction with it, which is can be done in our procedure room. Or if they need the surgical procedure, they may only need isolated neck. So it really depends on your evaluation. I just try to tell people, honestly, we want to do what you want to do, but we also want to make sure that your facial unit is in harmony. So if you come in and it's very obvious that you would benefit from not only a neck lift and a facelift, we're not going to try to force you to do one or the other, but we're going to tell you advantages and disadvantages of that. But there, a lot of times we do just neck lifts on patients.
Got it. And I'm thinking that this person also might be concerned with their age. Is 47 too young for to consider surgery?
Well, let me just say that I'm 74 and I had one 4 years ago. So I think it depends on your health. Many people say, I don't mind having a procedure done, but gosh, I don't want to have anesthesia or whatever. And I think all of our doctors here are doctors first. And we always tell our patients, we're going to work you up medically and make sure that you've had medical clearance before we operate on you. So I believe that we're not going to take you back there if we think there's a risk. And we have very, very good anesthesia providers here. So I think we have to just look at the big picture.
Yeah. And we definitely have lots of patients in their 40s that are interested in getting surgery safely. So it is definitely not, too young by any means. I think right now in the news, people are talking about doing it in their 20s, which maybe that's another story, but 47, definitely appropriate. All right. Here's a good question. Do you recommend vasor liposuction for someone who's had 3 kids, or is it mandatory to really have a tummy tuck?
Kind of like what Dr. Hill is saying, it just depends on the examination. Because the vasor goes along with liposuction, which helps reduce fat. But it helps a little bit with skin retraction and skin laxity. But if that is the main issue, that's where a tummy tuck comes in. Because if that's the main issue and you just do liposuction, that's going to make the problem worse. So, if there's a lot of extra skin, you need to cut it off with a tummy tuck. If you're unsure, that's what the consultation is for. I can tell you and show you and explain the pros and cons of each. So I think that kind of trips a lot of people up when they go to try to do their research. They see all these different procedures and, they get confused on what they might need, but that's why we're here. So that's what a consultation does. We're here to help guide you and explain to you what each procedure does and what is going to be the best for your body type and what we can help achieve. So it can be so confusing when you look into it yourself. But again, that's why we're here to help guide those decisions and help you. So
Great. I love that. And um, we have more questions coming, so that's fantastic. I'll just want to remind everyone that I popped in the chat that the link to book online because it is a little after hours here, but you are welcome to click that link and you can book your med spa consultation, which I misspoke. It's $50, but it goes towards any treatments. And you can book a complimentary consultation with one of our surgery coordinators, Vinny and Jacob, and both of them are fabulous. And they will take a lot of time, talk to you, and they can actually even give you an estimate for the price over the phone before you even come in and meet with Dr. Hill or Dr. Ford. I have a busy schedule. How long is recovery after a mommy makeover? I'm 43.
I totally understand that. Same. So it kind of depends on what you mean for recovery. Most patients are off the pain meds within about 2 weeks, although it's pretty variable for that surgery. You typically have one drain after surgery only for about a week, and you're going to be walking like a little old lady for me for about a week, a little bit hunched over. Um, and then overall, you're not going to be even thinking about working out for about a month or so. And basically, no heavy lifting for about 6 to 8 weeks. Because again, that muscle repair is the most sore part, and it's what is going to limit the activity most of all. You're going to wear a compression garment for about 6 weeks to help that swelling go down the most. It has to do a lot about kind of what your job is, if there's any heavy lifting involved, if you have like little ones and things like that. If you have like a desk job or if you work from home, that's what I was talking about, where most people are probably okay back to work at about 2 or 3 weeks. Again, it kind of depends, but probably a range like that. But again, no restrictions, closer to 6 to 8 weeks.
Got it.
And then the breasts are usually, that's again why I like to do it at the same time, because most of the time patients are like, I forgot we even did the breasts, because the abdomen honestly is a little bit more sore, and the recovery like doesn't even add anything by doing the breasts with it.
I love that. So if someone, just needs to, well, how about taking my kids to school and picking them up from school? How soon am I going to be able to do that?
Usually about 2 weeks, because basically you just have to be off the pain meds to be able to drive. You have to get in and out of the car, things like that. So
Okay.
somewhere around there. I have had patients where I do a mommy makeover and they just take Tylenol afterwards. That is not the norm. So it's a little hard because everybody is so different. But that's probably the best range I can give you.
Okay.
Somewhere around there.
That is helpful to understand. And yes, and for those of us that work a desk job in front of Zoom, I mean, you are capable of doing that sooner for sure.
Yeah, those are my favorite.
All right, here's a good question. I know you guys have a Rancho Bernardo office too. Do any of you ever go see patients there? I live in Escondido, so would prefer to meet you all there.
Well, I go there for the med spa treatment, so I'm there once a week on Wednesdays.
Yes.
And on occasions, I will go down there if there's a request. We certainly, we try to accommodate the patients, but
I agree.
Dr. Ford and I are primarily at the Murrieta location.
Yes, but we can accommodate you with Dr. Hill at that location. And then we do also have an amazing board certified plastic surgeon, or board eligible plastic surgeon, Dr. Rodriguez, who is at that location full time. So absolutely, you can go to Rancho Bernardo and you will still get the Renuance experience and all the Renuance love.
Yes.
You keep an eye out, because we're going to be having an open house at that location fairly soon. So you'll definitely be able to meet him fairly soon if you wanted to come to that event.
Yes, thank you so much for reminding me of that. And that one is going to be on May 15th. Did I get that right? May 15th. So if any of you want to mark your calendars in Rancho Bernardo, we are going to have an opportunity for you to come in person and meet the surgeons and talk and just go over all these things in person. All right, so Dr. Debbie, I am not ready for surgery. Can the CO2 tighten my face? Is that an option at the med spa?
Well, it certainly is an option for you. We can improve, the overall skin texture, the fine lines, and even the deeper wrinkles. So yeah, we definitely can do that. And if you're not ready for surgery, I mean, I think it's a good idea if you want to improve some of those things and get ready for surgery, maybe, however long you want to wait. I think that's always helpful to have good skin when you go into surgery. So yes, we would be happy to do that.
Absolutely. And just so you guys know, we have lots of patients that come in and do these non-surgical treatments just to prolong the time until they feel that they need surgery. And a lot of times, Dr. Debbie can buy you many years before you feel like you actually need to go under the knife.
I think even though I don't do a lot of the facial surgery, I think the CO2 is such a great adjunct because even with the facelifts and things like that, the CO2 is the facelifts and things don't do the skin resurfacing. They remove extra skin and lift things and they add volume with the fat grafting, but the CO2 is for the skin texture and the brightening. So that they just work hand in hand so well together. So yeah, you can definitely start there, but they just work so great together and just to add to each other.
You're right. So it's always a
Yes,
good thing to do
absolutely.
as well.
Yeah.
Mhm.
Oh, sorry, Dr. Debbie, were you saying something?
No, that's exactly right. Yeah, it's very
Perfect.
helpful.
Oh, someone just said, I've been a patient here for many years and you guys are the best! Exclamation mark. Thank you
Aw,
so
Oh,
much.
that's sweet.
Whatever that is. Okay, so here's a big question. Will insurance cover any of this surgery after weight loss? And if not, do we offer any financing options?
You would think that they would. Unfortunately, that's usually not the case. You know, insurance usually will not cover these procedures, even though they do have a functional aspect to them. Um, insurance is covering things less and less. We've just seen as a country as a whole. So you can definitely try, and we can help do whatever we can to help you submit to your insurance, but it's unlikely that they would cover any of these procedures. And yes, we do have financing options. That's about as much as
Okay.
yeah.
I can help with the
Offer.
financing.
Yes, yeah.
So covered by insurance. I wish everything was covered by insurance, but what I will tell you guys is we have a fantastic partner that knows everything about insurance billing with plastic surgery. And so you can talk to them, they can look at your specific insurance, talk to you about the conditions, and there is a chance. But like Dr. Ford said, we don't want to overpromise and underdeliver. So I wouldn't expect insurance to cover the weight loss procedure unless you really have a proven medical necessity, like maybe you're going through rashes or skin irritations, or you have an infection and the excess skin rolls or something like that. So, but we do
Even then, it's just very difficult.
yeah,
It's an uphill battle. Let me just say that with the
as is
insurance.
everything with insurance, right? But
Yes.
as a practice, we do work with insurance if you are eligible and if your insurance does cover it. And sometimes we can get coverage for things like a breast reduction, or different treatments that we offer. All right. Ooh, we only have a few minutes left and so many questions. We'll try to get through as many as we can, guys. So is someone a candidate for a non-surgical skin tightening like Vaser if they have very little fat and it's mostly loose skin issue?
Well, if it's mostly loose skin, probably Renuvion, which is again a radio frequency device that also works with helium. That probably is one of the better options for skin tightening. They can also do skin tightening in the spa with a laser. If they're not wanting to have a general anesthetic, these are things that can be done. The Vaser itself, you can do the Vaser with the neck on very low settings. It's possible to do that if they have a little fat they want to get rid of in the neck. But to be honest with you, I think if there's not a lot in the neck and it's mostly loose skin, doing our standard handheld devices to remove some of the fat along with the Renuvion probably will give them an outstanding results.
On the body, if there's a lot of extra skin, even if there's not fat, again, some of these devices will give some improvement, but if there's a lot of extra skin anywhere, likely they're going to need surgical excision of it.
Okay, 2 more questions. So I have heavy skin on my eyelids. Do I need to have surgery or are there any other options?
Well, yeah, and you'd have to take a look at what heavy skin means. But typically, a surgical procedure is going to be required. However, I know, on social media, you see a lot of use of the CO2 tightening skin around the eyes. So we would have to have you come in for a consultation, to take a look, at actually how heavy it is. If it's fairly heavy, I mean, the best option is going to be a surgical procedure. Yeah.
And a lot of times people will come in and they'll say, I've got heavy eyelids. And when you start to do their evaluation, you may find that the issue is their brow and not
Yeah.
their eyelids, or it may be a
Mm.
combination of the two. So I agree with Dr. Debbie, the skin tightening procedures with lasers, if there's not a lot of excess skin, especially around the lower eyelids, that's very, very helpful. But if there's a lot of excess skin or just heaviness there, they're probably going to need a surgical intervention.
Yeah. But what I will say is, if anyone is curious, and even if you're a little nervous about surgery, coming in for a consultation does not mean you're signing up for surgery by any means. It just means that you're going to hear from the experts and talk through and know your options. And maybe 5 years from now, you'll make the decision. But I mean, I encourage you all, I think having a consultation so you have one of these expert physicians look at your skin and look at the situation and tell you the best option. So. All right. How many syringes does it take when you have a lot of weight loss in the face?
I mean, then that's a good question. And again, if there's a lot of weight loss in the face, again, fat grafting and a surgical procedure may be what is going to be the best thing for you. But depending on how much fat loss there is, we take a look at the face. The person that I had did in one of the photos, I had done probably 3 syringes in her over just a short period of time, if that gives you any kind of um, clue there. But it does depend on how much weight loss is actually there. And we certainly can do it. We don't have to do them all in one session. We can plan that out as well. And then myself and, the nurses that are in there, Chelsea and Lordana, are very experienced too. We're very honest about, how many it would require over a period of time. And then, we kind of decide together whether or not you feel that that's monetarily efficient for you, or if you just would prefer to save, for maybe a surgical procedure.
All right, everyone. So we made it through all the questions. Thank you. They were great questions today. To wrap this up, I want to remind everyone that we understand that so many people are dealing with this sagging skin issue right now, and we want to help. So the first 3 people that come in for a consultation and book their surgery, we are going to give a huge discount for them. We don't do this very often. I really had to fight for it. So I encourage you all to go online and book your consultation with Vinny or Jacob ASAP. And that's whether you want to go to RB or Murrieta. Either way, the first step is to get on the phone with one of our surgery coordinators, and they'll help talk everything through with you and get you scheduled. And I know that we have a lot of people that are interested in this, so they're going to go fast. So I want to make sure you guys get in quickly. You also can book online directly. If you know you already want a treatment with Dr. Debbie at the Med Spa, you can book that treatment as well. But ultimately, I know this is a big topic for everyone right now, and we really hope that this provided you with a lot of information so you know what your options are and you can make the best decision for you. And we certainly hope that if Renuance can be of assistance for surgical or non-surgical, that you will entrust us with your care, and we would love to be your partner in this process. And you guys saw from the results today, we really have changed a lot of people's lives by, you know, removing excess skin. And I mean, even just tightening up a little bit. If it's going to restore your confidence, that is worth $1 million right there. So thank you, doctors, so much for taking time out of your busy day after all your surgeries today and patients to talk and teach to us all. Thank you for those of you that joined us. I know you're all busy. Many of you are busy moms working, whatever you're doing. So I appreciate you giving us your important time as well. And most of all, we hope to see you soon at Renuance, and we would love to help you. So thank you guys so much. Talk to you soon.
All right.
Bye.
you.
Thank you.
Thank you.
Bye.
Bye-bye.
Bye.